Hello everybody, this is Dr. Sima Aiden. I would love to share my journey with you as to how I got myself out of the pre-diabetes zone and struggled with blood sugar imbalances for many years, as well as losing weight with the help of Ozempic. I have a very strong family history of diabetes. My mom, starting mid-50s, started to have actually complication of diabetes related to heart and eyes and every organ of her body. And almost 3 years ago, we lost her because of the complications of diabetes. And all of her brothers and sisters also passed away because of the complication of diabetes. So you can imagine when a year and a half ago, I got my blood work and my hemoglobin A1C was 5.8. And the number range between 5.7 and 6.4 is pre-diabetic range. So I was really not only shocked, also frightened, extremely frightened, because I saw my mom's quality of life in front of me, just like a movie. And I was shocked because my hemoglobin A1C the year before was 5.4, which is normal. Anything below 5.6 is normal. And the year before that was 5.2. And I always had around 5.2, 5.3 ranges, correct? So that was the shock came. And the fear came from the fact that I knew if I don't manage this, what is going to be my future when it comes to my quality of life. And by that time, I already had tried, not different diets because I'm not a yo-yo dieter, tried to be mindful eater, tried to exercise everything correct, but it didn't work. And the reason it didn't work because it couldn't be to the level that I needed it to be. And there were factors that would affect my consistency and my resilience and my strength. And personally for me, because I work and I have to take care of my child and have 2 dogs, basically all the responsibilities, it kind of could overwhelm one system, basically one body's. And that could lead into not being consistent with the proper lifestyle. So around that time, my brother was using Ozempic because of the diabetes. And I wasn't actually paying that much attention to the weight loss part of it. I was so focused on bringing down my blood sugar. So I started to go on Ozempic and with the purpose of bringing down my hemoglobin A1C. But to my surprise, what happened was all of a sudden I realized that my mind changed totally, meaning that I was a different person. I became a person that I was supposed to be from the birth. And unfortunately, because of cultural factors, because of environmental, because of social, because of the food industry, we have become a totally different person when it comes to our mindset towards eating and food. Meaning that all of a sudden I would see food not as a pleasure. And again, for me, culturally especially, food was always been a reward. Food always been a sign of love. They would love you or kill you with the love of food, so to speak. And I never thought that I could overcome that until I was on Ozempic and I realized that I can see food for what it is. That this piece of cake is really, what is this that is in front of me? This is horrible. And there wasn't any struggle to tell myself that. It came very natural, very natural. And one part of the decrease in my calorie intake, I contribute that to that mindset that was created in my in me. That was a new me. Another factor was basically the fact that because of the good side effects of Ozempic, I call it good side effects. Ozempic slows down the digestive system. It's one of the mechanism of action. Another mechanism is that it decreases the hormone that causes the extra release of sugar from the liver, and also it causes the pancreas to produce insulin. But the fact that it slows the digestive system, it means that you feel full, and content, you know what I mean? And if you eat a little bit more than you should, you're gonna have indigestion, you're gonna have like gas, bloating, nausea, that you're not comfortable. And this is your break to tells you, you know what, you overate, or you ate at the time that you should not have been eating yet, So that was another reason that contributed to the less of the mindful calorie intake, and eventually weight loss. The third factor was I have been using the continuous glucose monitoring devices. These are sensors that we put on the back of our arm, basically. And, one of them would be Freestyle Libre. And so what they do is that instead of we kind of needle our finger, the tip of the finger every day, this device would check our blood sugar, depends on what generation of the Freestyle we are talking about, every 15 minutes or every 1 hour, and the Freestyle 3 does it every minute, basically. It checks our blood sugar. And so I started to use that device, and that device helped me tremendously again to understand what food is doing to my system as me, correct? And also another use of it for me was, let me put it into the practical scenario. I have this habit of eating food when I'm watching TV, correct? And so it's just, and I realized that basic is calorie, correct? And the mindless calorie consumption. So I said, okay, I could think that this is not the right thing to do, and I could act on it, meaning that before I knew it's not a good thing to do, but I couldn't act on it. I would go ahead and eat it anyways. I needed that comfort, that contentment. It was my pacifier, correct? But then the minute I would start watching a TV, I would check my blood sugar, and if I had plenty of sugar in my system, then I could see it, that I don't need to eat anything. I'm fine. I have plenty of sugar in my system. And basically it has been a very proactive mind, body involvement that I really appreciate about the process. So it's not just a very passive process of using the Ozempic every week and then watching for the weight to go down, because I am really, really concerned about what's going to happen once we lose the weight and we want to come off it. That is the main question. And in the beginning, I thought, okay, I'm going to use less of it because I was using once a week. And now I can see the effect lasting in my system as far as how it is making my brain content and peaceful, so I can rational my behavior. I know that, okay, still is my system. So I'm using my Ozempic every 3 weeks almost. And so I'm seeing the next step would be decreasing the frequency, but until when, correct? So this is the place that I think that the way I look at the Ozempic process could be different from so many practitioners, maybe, that I really value the effect that Ozempic has on my mindset or individual mindsets, because I have seen it in other patients of mine. But then it's on us to really invest in what Ozempic is giving us. That's why in my program, Ozempic is one part of the program. Also, another part is that my patients have to use continuous glucose monitoring devices. Also, I want him to do journaling, and journaling not about what you ate, how much you ate. It's about like during my whole TV process, that was my goal to reprogram me and the way I'm thinking about watching TV. I not only would check my blood sugar, I also would journal my thought and how my brain was before the whole journey and how is it now and how normal it feels, how healthy and rewarding it is. So I keep emphasizing this aspect that hopefully once I decide to stop the Ozempic, so I am a kind of a different version of myself. And I am putting my mind into it to accomplish this goal by the end of my journey and starting a new version of the journey without Ozempic, correct? So this was my story, and I hope that it was helpful, and I will put other videos in regards to blood sugar, Ozempic, and also the psychological aspect of the process for sure. And take care of yourself and have the greatest day.